Let's face it, life gets a bit more complicated as we get older. It's good to know where to turn. If you are a senior or a family member and don't know where to begin to get assistance or information, Matt Trott will tell you more about your local area agency on aging.
Hello, I'm Matthew Trott with the GECAC Area Agency on Aging. I'm the director here at Greater Erie Community Action Committee for the Area Agency on Aging in Erie County. I'm going to share with you a PowerPoint so that we can walk through together what an Area Agency on Aging does and some of the services that it provides. Before I get into all the things that an Area Agency on Aging can do for older adults in Erie County, I want to go through a little history lesson as to why area agencies on aging exist and give you a background on how we interact with some of the other services and benefits that are available. If at any time you want to discuss in depth your individual situation or services that you may need, please call our senior helpline, 459-4581 extension 400, and one of our qualified staff will walk you through some of the process or give you some referrals to other entities that will help meet your needs. So as always, and you'll hear that number many times during this presentation. The area agencies on aging are from the Older Americans Act, and they're across the country. There's over 600 area agencies on aging in the United States. And as you can see in the top part of this slide, they provide rides to doctors' offices and grocery stores and other essential places like senior centers, as well as provide meals to individuals, older adults, and provide in-home services across the country, over 60 million hours of in-home services. GECAC, the Area Agency on Aging in Erie County, provides over 30-some thousand rides to doctor's appointments and senior centers, as well as provides over 100 and nearly 30,000 meals to older adults. They also provide the nearly 50,000 hours of in-home services to individuals in Erie County age 60 and above. So let's go back to that history lesson that I wanted to talk about so that everybody understands why area agencies on aging exist. It all goes back to 1935 when Social Security Act was passed. So Social Security provides forced retirement savings for individuals. If it wasn't for Social Security, there'd be 40% of all older adults age 65 and older would be in poverty. So very important, as I think everyone agrees, that Social Security is there as a safety net for a lot of us in our retirement years. Fast forward 30 years to 1965, and the federal government realized that the health insurance costs for those individuals in their retirement years and patients with disabilities were basically undermining the safety net of Social Security. So they enacted Medicare in 1965. Medicare doesn't matter what your income or your medical history is, it is health insurance for everybody age 65 and older. They also in 1965 realized there's some people that have no assets to be able to pay for things like long-term care, like nursing home and personal care services. So Medicaid was also enacted. So big difference between Medicare, which is available for everyone regardless of income, and Medicaid, which is there for individuals with limited means or assets. Medicaid is very important. And the other thing I wanted to highlight to make sure that everybody understands is you're not alone if you need Medicaid. 23% of Americans, 74 million people who are low income and or disabled, have a need for state and federal assistance under Medicaid. So it is a true safety net for 1 out of 4 Americans. That leads us to area agencies on aging. So our area agencies on aging were created to give local decision making and local flexibility to services to best provide local community-based solutions for older adults. Enacted in July 14th, 1965. And then Erie County, we were designated the Area Agency on Aging at GECAC for Erie County in 1974. So it took 9 years to get it up and running. But like I said before, there are over 600 area agencies on aging across the country. Key to what we do here at GCAC and the Area Agency on Aging staff, uh, we navigate you through that aging journey, through the maze of the services and supports that are available to you, whether those are Medicaid, whether those are Medicare, whether those are options lottery funded services here in the state of Pennsylvania, or any other services. We can help guide you through that. Um, the reason these are so necessary and valuable is this classic chart really has to do with the population. There's just a lot more older adults and people are living longer. The dotted line is from 2007, but we're really up here in 2023. And Medicare and Medicaid, the costs of everything that the country does is really starting to go over 20% at this point in time. And that's again because of this age wave, the silver tsunami that they call it. People are living longer, as well as the fact that there's just more from the baby boomer generation who are turning ages 65 and plus and better. So that's why the area agencies aging exist and why we've been around since 1974. And our goal is to maintain older persons in the most independent living environment possible. That truly is help you stay in your home for as long as possible so you don't have the other high costs of care, of long-term care like nursing facilities and the like. And we do that through a variety of funding sources, including the Pennsylvania Department of Aging, the Federal Older Americans Act, and also some Erie County government funding. So let's go through some of the things that an area agency on aging here at GCAC can provide to older adults. This is where we're located, our main building, and um, we are open normal operating hours 8:30 to 4:30. So feel free to give us a call during any of those times at 459-4581 extension 400. It is our senior helpline. We have 72 staff right now. Most of them are care managers who can assist you with getting your needs met, or at least walking through your individual situation when you call. We're one of 52 area agencies on aging across the Commonwealth of Pennsylvania. And the key to Pennsylvania's area agencies on aging is the lottery. So we all know that the Pennsylvania lottery benefits older Pennsylvanians every day. And most of the lottery funding, of course, goes back into lottery winnings. But 23% of all the money that the lottery makes goes back into benefit programs for older adults. And that is a key funding source. In Erie County, as you can see from this slide, the Area Agency on Aging here at GCAC, we get about almost $5 million a year, and that has increased a little bit since this slide. Um, there's also the prescription assistance program called PACE and PACENet in Pennsylvania. That's about $2.5 million to Erie County older adults. Um, the rides we provide are funded through Department of Transportation, and we also assist people with getting property tax and rent rebate applications. So about $6 million goes back to older adults here in Erie County, as well as the Medicaid program through the Department of Human Services utilizes some of that lottery funding. And it all starts with a phone call. So if you are concerned about anyone age 60 and older and wish to get more information, please call the number 459-4581 extension 400. Our information and referral staff will help guide you to get your service needs met, as well as they could schedule you if you are more interested in Medicare or Medicaid counseling. They can assist you by attaching you to a Pennsylvania Medi counselor, and I'll talk about that program a little later. If you have a smartphone, go ahead and click that, and that'll get you right to the internet link, gcac.org, and under the aging services, you can see all of the programs we have and the eligibility for each one of those. So let's get back to the Area Agency on Aging and how we coordinate some of these services. life is complicated, especially as you get older and as you're dealing with an older relative or loved one, to make sure that they have all the services they need and they're safe in their home as long as possible. And that's what we're here to help support. Um, the number of older adults in Erie County is nearly 70,000 older adults age 60 and older. As you can see here, the 1 in 6 Erie County residents are older, older age. And GCAC Area Agency on Aging provides services to help those individuals, not only rides through the lift and the E to get to a senior center or a medical appointment, but also meals, both provided delivered directly into individuals' homes through Meals on Wheels, as well as meals provided at the senior centers that we operate. We also provide over 50,000 hours of in-home services each year to roughly about 700 to 800 older adults. And one of the ways that we can help coordinate those services and be able to do that for those 70,000 older adults in Erie County is for some older adults who are able, they can volunteer their time and give back and help their fellow senior citizens. So we have a couple volunteer programs, the Retired Senior Volunteer Program, as well as the Foster Grandparent Program, to enable individuals to give that time back, so to speak, if they're able to. So I encourage you to call. There's a lot of benefits to that. We all know, especially during COVID, that social isolation was a huge issue, causing a lot of seniors to just feel lonely. And by volunteering or by attending a senior community center right in your home town or city or neighborhood can really go a long way to help you and older adults stay active and healthier. And these are some pictures of some things at our senior centers. I'll go through where our senior centers are in Erie County. Again, we can provide you transportation through the lift to get to a senior center. Most of them are open 4 days a week, some Monday through Thursday and some Tuesday through Friday. Here are the locations of our senior centers. There's 7 of them that GCAC operates directly, and there's 2 that we use lottery dollars to support. The JFK Center out on Buffalo Road, as well as the Mercy Center on Aging at 37th and Pennsylvania Avenue in Erie. And then we also have our RBW Wiley Central City Seniors Activity Center here at 8th and Peach, our Erie West Senior Center at 1200 block of West 8th, and there's centers out in Corey, Northeast, Albion, Fairview, and Union City. So I encourage you to encourage your older adult to attend those centers, and there's all sorts of activities, as well as they can get a meal during those 4 days that those centers are open. Everything we do at the Area Agency on Aging, every 4 years, we do a overview of the needs of older adults in Erie County, and we publish that plan with the Pennsylvania Department of Aging State Plan on Aging, coordinate the goals and services for what older adults need. So what do older adults need from our surveys and our analysis? They really need to stay healthy and active. There's evidence-based healthy steps and make sure that fall preventions, because falls are one of the first and foremost ways that individuals start to need long-term care services as well as hospital stays, and we don't want that to happen. So we have evidence-based health and wellness things, exercising classes and the like at those senior centers to help keep older adults healthy. I already mentioned some of our volunteer programs. Our Pennsylvania Medi counselors can also be volunteers to help guide you through the confusion of Medicare and Medicaid, as well as we have local ombudsmen who can advocate for residents in long-term care facilities, and they're always looking for volunteers to help do that in addition for the 20-some long-term care facilities in Erie County. How do we help older individuals remain at home in Erie County? First and foremost, we care manage them. Our 70 some staff, about half of those are care managers, social workers who will guide you through these programs. Um, they can help provide a home delivered meal. As the slide shows, we have 107,000 home delivered meals that are each year delivered. We could get you a emergency response system. That's the button in case you do have a fall and can't get up. We provide a lot of those safety devices. We also provide support for medical equipment and supplies, as well as that personal care, that in-home services to assist with your activities of daily living, like bathing, dressing, and the like for those that need it. Um, the area agencies on aging, especially here at GECAC, provide all these services to individuals age 60 and older. And we do that for about 10,000 individuals each year. Most of those are just a call through our information and referral to our senior helpline, 459-4581 extension 400, and also the care management service that we provide to everyone who calls and is able to go through what's called a needs assessment tool, which helps identify what services you need or your older adult needs. And it's all to keep everyone healthy and safe, and so that they're aging safely in their homes and remain in their homes as long as possible. Caregivers are the key things that we want to support. We have a couple programs here at GCAC to support caregivers. We have a caregiver reimbursement program, which for those that are income qualified can get up to $600 a month in reimbursements for the cost of providing care. That program also provides support to grandparents who are raising grandkids. So again, as the baby boomers age and turn 65, as you can see on this chart in 2023, we're right here where the orange changes into the green, and there's a lot more older adults in need of a caregiver than there are caregivers to support them. The chart on the left here shows the number of caregivers in the population for the people age 65, and we are starting to go down this curve, and right now there's only about four caregivers in the population able to provide care for all the people that need it. And that's a drastic drop from the 7 that were available back in 2010. And it's only going to get worse for a few more years here to find caregivers. So we will help to make sure that our caregivers are supported as much as possible to help meet our missions of keeping people safely in their home. And again, it all starts with a phone call to our information assistance and referral, our senior helpline, 459-4581 extension 400. If you have a smartphone, you can scan the code there and that'll take you directly, or go to the internet at gcac.org and look at our aging services for more details. That is the bottom line. Wanted to thank you very much for listening to this overview. For specific programs, you can look for those programs and introductory guides on our website. Thank you.